Thank you, and welcome everyone to our October 2025 Health Equity Jam session. Um, I hope you guys are having a nice fall day so far, and hope you also enjoyed our music chosen by our speaker for today. So the first thing we're going to do is, well, first I'll introduce myself. I think most of you know me, but I'm Lisa Cooper, and I'm the director of the Johns Hopkins Center for Health Equity. And this afternoon we have Dr. Adam Seth Levine, who is going to be our speaker. But we are not going to do our academic introductions, Adam. We typically do our fun facts, and then it's just to kind of get everybody more acquainted and in a sort of relaxed way. And then we move into sort of the more traditional academic introduction and that sort of thing. So we've got some really good fun facts for our speaker today. So first of all, we all have these dreams when we're children, right? About what we want to be when we grow up. So our first fun fact has to do with what did our speaker, who or what did he want to be when he was a youngster and trying to figure out what he was going to do with his life. So we're going to take some guesses in the chat and see who comes the closest. And if nobody gets it, then we'll have him tell us what it is. So let me see. I'm going to try and make sure I can see in the chat. Oh, some people are just like interesting. Aerospace engineer, astronaut, or rock star. Musician, haha. Artist or singer, artist. Oh, people are sort of just, you've got that artsy look about you, Adam. Author, baseball player.
I
Well,
think it's the name. That was a pun. I think it's because of his name.
okay, all right. Preschool teacher. Okay, all right. Oh, hey, these are great. But nobody has it yet, even though some people put in some interesting responses that might correspond to another fun fact. But this fun fact, there's no one that's gotten the answer yet. So Adam, will you tell us what you wanted to be when you were growing up, and maybe give us a little bit of the story about why?
Sure. So hi everybody, first of all. I'll just say I do very much appreciate the folks who said sort of like the artist singer. Just because of the Adam Levine, the rock star Maroon 5 guy. I'm happy to sort of share at some point what it's like to actually have that name, because I can't tell you the number of times that people come up to me, especially on like airplanes and stuff, and they were like, "We saw you on the manifest, and we were kind of wondering." And then of course I show up. Anyway, be that as may, when I was growing up, I really wanted to be a game show host. And the reason is not because I was not like into like drama or like being on stage that much as a kid per se. But the reason why I wanted to do it was because whenever I was sick from school and I had like really bad allergies, I missed a lot of school especially in middle school because of really bad allergies and stuff like that. But the one thing about missing school that I always loved was I got to watch like game shows like during the day. Like that was the highlight. And so as like a little kid watching like The Price is Right and watching Family Feud and watching Wheel of Fortune and like all that kind of stuff was just totally like, the thing I was excited about.
Yeah. Hey, I mean, so Adam, you and my mom would get along really well. My mom spends a lot of time watching game shows right now. Anything but the news, right? So, but anyway, so that's a real fun fact. Now, there's another fun fact that you guys are gonna have to guess, and this is about like kind of maybe like a real hobby kind of thing that our speaker is really into. And you might have gotten some clues already. I don't know. Actually, can't really see much on the screen right now, Adam, of your background or anything like that. But of course, there was the music, and there's the game show theme, and there's a whole bunch of other things that we've heard about. Some of the guesses in the chat. So what's a major hobby of our speaker other than wanting to be a game show host when he was young?
Yeah, I actually have to admit, I don't even like, we don't even have a TV now, so I don't even like watch the network anymore. But I huge, yeah, so model airplanes, exactly. And yeah, so I'm a huge aviation geek. And so
Mhm.
everything related to like being on airplanes, being in airports, like flying places, all of that kind of stuff. And I'm like more than happy to like fly places for like a day for like work stuff or whatever, and then like fly back. Like I am all about it. And one of my favorite activities is airport tourism, which is where I sort of schedule an exceptionally long layover for myself, so I can basically walk an entire airport and just like see the whole thing. And also schedule, and of course you have to like, if at all possible, scheduling like extra layovers or sort of a random like roundabout route and things like that. I try to do that if at all possible. And also just like follow the industry and and I contribute to some like message boards and chat boards online and things like that. I know the
Awesome.
model airplanes. Yeah, there's
Yeah.
a whole.
Yeah.
I mean, you can't quite see all of them, but there's a bunch of them.
Oh, and the music basically tell people what the music was for those who don't didn't know what it was.
Oh yeah, sure. So like, so I basically like, so what it was is basically the soundtrack for Qantas. So like
Mhm.
which is the Australian carrier, and and I absolutely like love it. I literally will listen to, so the prompt from Lisa and her team was basically like, give us, your favorite music. And I was like, literally, I listened to this soundtrack, like basically on repeat, like all day. And it's like, it's two songs that are about like 30 minutes total. And I'll just like listen to it on repeat. And it's actually kind of nice because there's no vocals and stuff like that. So it's really like, I feel like I can work pretty easily with it.
Cool. Very, very cool. So let's see. So there's another really funny fun fact. So I mean, I don't know how many people have a nickname. I know, I'm sure lots of people do, right? Yeah, everybody's got a nickname. So, what was our speaker's nickname when he was growing up?
Wait, should I say it or should I?
No, oh, let them guess.
It's not exactly the most flattering thing in the world, but
So I do want to say while we're guessing, there's a person who's a call-in user, and if you could identify yourself in the chat, that would be very helpful. Otherwise, I may ask, I may end up removing you. I'm sorry to do that, but this is a safe space. So we want to make sure that we have the names of people who are participating. So please identify yourself, call-in user number one.
Dr. Cooper actually already waiting room and I sent them a private message. So I did put them back in the waiting room.
Okay.
So I sent them a
All right.
message.
Thank you. All right. So, Alex Trebek, Aviation Adam, Plane Boy. These are pretty funny. These are really funny. So, Adam, what was your nickname and why?
I actually have to admit that I was not that much into aviation as a kid, and it's actually one of those interesting things where it's sort of like I was into it, but I hadn't sort of like named it, and nobody like we didn't fly a lot like as when I was growing up. I grew up in New Jersey, and I actually grew up not that far from Newark Airport, so I would often be on. I don't know if anyone has sort of been to Newark Airport, you might know sort of the New Jersey Turnpike runs like right by it, and you can actually see the planes taking off and landing from the Turnpike. So I do like very much like when I was, 7 years old, 8 years old, 9 years old, like all whatever. And then as a teenager, like anytime we were on the turnpike, like my face would be glued to the window when we drove past the airport to watch the planes taking on or taking off and landing. But I hadn't quite named it. And so that was unfortunately not the nickname at all. No, the nickname and so this came from a group of friends who I'm actually still like I somewhat remarkably I guess like still in touch with, and we're all from New Jersey. Only one of us still lives in New Jersey, but we're all typically there for Thanksgiving still. And so I'll actually see them in about a month or so. But anyway, the nickname was Grandpa, and that was because I was very good at complaining.
Okay.
Um, And sometimes it was actually pretty sincere. Most of the time, I think I was good with just sort of like coming up with like, complaints like just about whatever, stuff that like didn't really merit complaining. But anyway,
Mhm.
so yeah,
Oh,
it was
cool.
Grandpa. I do like I'll go with Aviation Adam though, and stuff. But we'll have to. I'll tell them to call me that at Thanksgiving.
Well, somebody says grandpas are really into model airplanes.
It's interesting. I mean, mine was not, but and people often ask me too, like, why are you so into planes of them? And I'm like, I have no idea. Like, we never flew as like when I was growing up, like with, my parents or whatever. No one is like into this stuff. No one's in the industry, nothing. I have no idea.
Yeah. I know some people on here probably know this too. I have a son, and I told Adam this too, who is a total aviation geek as well. So when he told me that, I was like, he and I could actually converse on a few things, which I
Mhm.
think you were surprised by, right? Hmm.
No, it was great. And yeah. Although I forgot to ask, does your son live in the area? Because I'm like, we should go
He,
plane spotting at BWI.
he does. I will tell him that. And so I'm sure he would love that.
Yeah,
I will. I'll pass that message on to him.
totally.
All right. So, okay. Well, let's get down to like business here. We're having fun and we're going to continue to have fun. But
Hmm.
so Adam is actually the SNF Agora Professor of Health Policy and Management here at the Bloomberg School of Public Health at Johns Hopkins. And many questions pique his interest and excitement, such as when ordinary citizens become engaged in civic life and how people with diverse forms of expertise, such as researchers, practitioners, and policymakers, collaborate to tackle problems. He's published research findings addressing these questions in a variety of political science, public health, transportation planning, climate change, communication, law, and economics journals. Talk about a diverse portfolio here. So in 2024, he published his second book entitled Collaborate Now: How Expertise Becomes Useful in Civic Life. And he's also president and co founder of Research for Impact, a nonprofit that creates powerful new collaborative relationships among researchers, practitioners, and policymakers. So, without further ado, Dr. Adam Seth Levine.
Great. Well, thank you so much. Thank you, everybody, for being here. Thank you for the introduction. And I will admit, I actually really love this way of sort of starting talks, especially on Zoom, where it's sort of because otherwise, like all I am is just kind of this square with like a moving head and stuff. But like now, there's like a little bit more sort of like life form to me. I feel like it's a little bit more fun. So I appreciate that and all the comments in the chat box. So I'm gonna. So I think the way we had talked about in advance was that I'm gonna share my screen, which means unfortunately I won't be able to see people, and I always hate that about sharing screens. So if folks have questions, I'm not trying to ignore you, but I won't be able to see it. But the idea is basically I'll talk for like about 40 minutes or so, and then like take off the share screen, and then do Q&A. And also, I guess just to kind of set up the talk, that this is a topic that, I care a lot about, and also that I hope is sort of both, I mean for it to be both, like, hopefully interesting, but also to maybe have some sort of actionable stuff attached to it as well for folks in the room, at the very least, to sort of think about how it might be actionable for you in your daily life / your professional life. Okay, so with that said, let me share the screen. I always feel like sharing the screen is like it's like a reminder of how I have 95 windows open. And I'm like, let me make sure I like share like this screen and not the one that's like the undergraduate lecture for tomorrow morning. Okay. Can everybody see that? Does that show up? Okay, cool. All right. So the title of the talk is Policymakers Unmet Desire for Science. Okay. So one of the things that we have been hearing a lot about in the news, in emails from President Daniels, et cetera, is the relationship between science and society. And in particular, sort of, I think, like kind of one piece of that, which is this kind of longstanding social compact between the federal government and research universities in the United States. And that's something that President Daniels talks about quite a lot in particular. And so So the way that goes, and that kind of largely, comes from, it never, of course, only comes from one place, but one very influential sort of place that it comes from, is the report that Vannevar Bush, who was the director of the Office of Scientific Research and Development during World War II, he wrote this report, essentially to President Roosevelt, but then Roosevelt died, so it went to Truman, basically sort of like making the case for why the federal government should invest in scientific research at institutions of higher education, in peacetime. So there had been all this sort of research that had happened during the war, and like lots of sort of advances that were sort of thought to be really like, helpful for the war effort, like them or not, but things like sort of, well, penicillin people generally like, radar people are generally like, atomic bomb, obviously people have more mixed feelings about. And so, but those kinds of scientific advancements were sort of viewed as like, wow, like this is really like science, is really like, important during wartime. It should be important during peacetime too. The federal government should make these investments. And so anyway, so that kind of like, and the basic argument was that that Bush made, which ultimately sort of like shaped legislation such as the creation of the National Science Foundation, and then also huge increases in investments to other research institutions, like, for example, the National Institutes of Health, like in the late 40s into the 50s and beyond, was basically just that like the federal government should spend this money on science and basically leave it up to the scientists to decide what to do. And that if the federal government like invests this money in like science, then and leaves it up to the scientists to decide what kind of scientific discoveries to pursue and questions to pursue, that will lead to this kind of reservoir of findings that ultimately will improve sort of health, wealth, and security. And so there's this like kind of direct thread that Vannevar Bush drew in this Science: The Endless Frontier report that was essentially saying, look, like, if the federal government advances in this this scientific research, leaves it up to the scientists to do what they know is what they believe is best, it will ultimately improve the nation's health, wealth, and security. And that's sort of that link. Okay. So since that's come out, there have been several critiques of that model that Bush laid out. And really, it's sort of been organized around several different kinds of questions. One question is simply like, does this work? Like if the federal government makes lots of investments in science, leaves it up to the scientists to decide what to do, and then like, is that actually how we get sort of like, improvements in our health, wealth, and security? And it turns out there's a lot of sort of like examples where that actually isn't how we've gotten the kinds of technological advances that improve health, wealth, and security in lots of cases. And the kind of example people often like to kind of draw upon is if you look at like, think about like all the stuff that's in the iPhone and related to computers, related to the internet, and things like that, that like so much of this really came from sort of like Department of Defense, like, mission investments, not sort of things left up to scientists. So that's one. Second question is, are the outcomes that we get from the Bush model equitable? And in fact, like there's all sorts of examples where, we might have technological advance, but like, it turns out the things that we get, let's say, for example, drugs, they're too costly and or they're not available to everybody, drugs, vaccines, et cetera. There's a number of examples. So the outcomes aren't equitable. And then there's another question that people have asked, which is, are health, wealth, and security actually the only outcomes that we care about? Like, nobody's going to argue against them, but like, is that all we care about? And so like Danielle Allen has been making the case, especially even, recently in 2025 to say, well, we also really should be caring about civic health, and whether or not sort of the civic sphere is healthy. Okay. So those are a number of different critiques. So what I'm sort of like presenting to you today is sort of essentially another critique, which is that which focuses on a different question. And the reason why I'm focusing on a different question is because this link between sort of scientific discovery and societal outcomes really depends upon decision makers, including policymakers, including civic leaders, community leaders, voters, others, basically sort of like, knowing about the science and then sort of crafting policies and making other decisions that actually are going to improve health, wealth, and or security in the communities where they work. That's like one of the sort of key ways. Of course, that's not the only way in which sort of like scientific advances can improve society. I mean, so, having industry, license patents, of course, is another way. But this is like a really, really important way. And so we need to be asking, so because of that, my sort of like main argument is that we need to be asking a different question, which is, do decision makers have access to the scientific knowledge that they need, or is there unmet desire? And if there is unmet desire, then how can we surface that and how can we try to meet it? And so what I'm going to do in this talk today, so I have like a number of different sort of pieces of the stuff that I do of kind of my broader research agenda about like, focusing on this question, which focuses on a variety of different types of decision makers. But as you can probably tell from the title of the talk, what I'm going to focus on today is policymakers. And so the rest of the talk is really going to be on sort of this question about like, do policymakers have the science that they feel like they need to tackle the challenges that they're facing in communities they care about? Do they have it? And if not, what can we do about it? Okay. So we talk a lot about, so another thing that we hear about a lot is sort of the link, is sort of policymakers, often sort of either being like pro-science or anti-science. And so here's an example of sort of, Trump proposes unprecedented budget cuts to U.S. science. So that's would be an example of somebody sort of taking more of an anti-science view. Then you have Congress sort of pushing back. This is from September. As we all know, we're sort of awaiting what the outcome of this process ends up being. But nevertheless, like, people sort of like taking a more pro-science view. And so, when I talk about sort of policymakers' unmet desire for science, effectively sort of, the argument is, that there might be sort of this kind of third possibility stuff. And so in answering that question from earlier, like there really might be this kind of third possibility. And so what I want to do is I want to sort of present like a number of different examples from a number of different areas, sort of that first relate to surfacing this unmet desire. And then later on, I'll talk about sort of one study that we've done to try to meet it. Okay, so first of all, sort of like, whether or not do local policymakers want to have an unmet desire to engage with local researchers. And the findings for this come from actually the book that Lisa mentioned, Collaborate Now, How Expertise Becomes Useful in Civic Life. It's in one of the chapters. And so the question here was basically like, so we have a nationally representative survey of local policymakers, including both electeds and appointeds. And so like, so electeds would be like sort of, your county legislators or like, elected county executives. And then your appointeds would be like managers, like city managers, county managers, folks like that. And so we asked them, first of all, like, are you working with local researchers to tackle policy challenges that you're facing in your communities? And what we found, this was a few years ago now, this was in 2021. We found that basically about 80% said that they had not interacted at all over the past year. But then we said, but do you want to be? And what we found was that about 50 or about 60% or so said that they would like to be. So basically they expressed this kind of unmet desire. Actually, yes, like, now that you asked, I would like to interact with a local researcher around a policy challenge that I'm facing in my community. And, then sort of ask the question of like, well, okay, this means that you basically would be interacting with a stranger, I mean, effectively, right? And so, do you have any hesitations about interacting with local researchers? And gave them a list of possible hesitations and found that like at the time, the concern that they may push a political agenda was the most commonly mentioned concern. It was mentioned by less than half of the respondents, but nevertheless was the most common. But then there was this concern about researchers maybe not having practical information. And then afterwards, sort of a variety of other things, including things like, they may not value my knowledge and experience as a policymaker, which was mentioned by almost 1/5 of respondents. So, okay, so that was sort of like one example of kind of surfacing this kind of unmet desire. Another example, and again, a different substantive area, but had to do with sort of sustainability. And so I have a fantastic postdoc, Leah Kalinsky-Jones, who basically like created a population of sustainability officers who work for counties that are adjacent to R1 universities, so research-intensive universities across the United States. And she basically asked them about like, what are your sustainability-related challenges? What are your top challenges? And then, are you interacting with like researchers from like the local university around those challenges, and do you want to be? And so one of the kind of key things that she found in the process of doing this, so she actually so she created a list of the population of these folks, and there were about 62 of them. So there's not like that many of them, but there's like a decent number. She was actually able to get a response rate of over 60%, which was like pretty amazing, and to be able to talk to all of them. So one of the things, that she found was that 81% of the people that she interviewed expressed an unmet desire to engage with local researchers on one or more sustainability challenges that they were facing. And I'll just say that like one of the other things, that she kind of like, this wasn't one of the main points of like doing these interviews, but like, one of the things that she often said was like, boy, like, I never get asked like that the respondents would say things like, nobody's ever asked me these questions before. And so, which I thought was also kind of interesting. And just to give you kind of a sense of, what do they want to, like, what kinds of challenges do they want to collaborate on? Well, a lot of the stuff was related to resources. So things related to, how can we get more funding? How can we sort of get more staffing or better use staffing? Various technical capacity issues, which sounds, maybe not surprising for researchers. But then other kinds of things. So like political support and governance, for example, was very much sort of tied to effectively like, look, I might be a sustainability officer who is employed by my county, which maybe is a blue county, let's say, potentially. But yet I'm in a red state. And so how do I sort of navigate that kind of stuff, those kinds of federalism challenges? And then there was a number, and so then the third most common was process-oriented. She called them process-oriented, which really had to do with like sort of, how do I basically sort of like, so equity often was about like, how do I sort of bring in voices, like a wider variety of voices into the sustainability like process effectively? So, like we have to engage in sort of climate adaptation or mitigation. And, we want to make sure that we're doing it equitably, like kind of how do we do that? And then also issues related to sort of like, how much like, time, how much of my time and also time of people out in the community can I take and like what kind of makes sense for that? So anyway, so that was sort of just again an example, and I'm just going through these examples, thinking that like for each person in the room, like one of these might be interesting, but like probably all of them are not interesting to everybody. So here's the third example. This just got published a few weeks ago, actually. Which was looking at sort of policymakers' unmet desire to engage with bioethicists. And so here the question was basically like, not so much just are you facing a policy challenge in general or a sustainability challenge, but like, are you facing a challenge where basically you are sort of like, in particular, sort of facing like certain kinds of sort of like, tough decisions. And we gave them basically like 4 types of tough decisions. And so one of them was about sort of like, allocating scarce resource, kind of like a vaccine type topic, but not just vaccines. But then other things like, for example, so one of them was more specifically equity related and had to do with sort of improving those who are like the most kind of marginalized within the community, improving the well-being of those who are most marginalized within the community. Another one had to do with sort of use of resources. And so we had 4 of them. And so we asked these were nationally representative samples of now both local policymakers and then also some state policymakers. So basically we had like a nationally representative sample of elected local policymakers, nationally representative sample of appointed local policymakers. So that was sort of similar to before. And then we also had a diverse, but not nationally represented. We didn't have like survey weights for this one. National sample of state and local civil servants who work on issues related to sort of public welfare and sort of like family well-being. And it's basically sort of people who they do a few different things, but it's kind of all related to that. And so anyway, so again, the question was sort of about like, to what extent, do you already interact with bioethicists and to what extent do you want to be? I will just say that like, I'm going to say what many people might be thinking in the room, which is, how much do these folks like know what a bioethicist is per se? And I'll just say that like, for the most part, we asked them about how familiar you were with bioethics before the survey. And for the most part, people weren't all that familiar. I think it was like, certainly less than 20% said that they were extremely or very familiar. But one of the things that we did, and one of the things that actually I think made these surveys both interesting, but also kind of challenging in a way, was that we had me and Andy, we had a kind of like blurb at the beginning, which kind of describes sort of like who bioethicists are and like why it is that like they might interact with like policymakers in the policy process. And so we provided that. And then we asked the questions. So anyway, so what did we find? So the percent who interacted with a bioethicist at least once over the past year was like largely like not that many. I mean, it wasn't 0, but it was like, basically between 10 and 20%. But yet, excuse me, the percent who said that they would like to be more than they are. So in other words, the percent that expressed unmet desire was basically between 40 and 50% for across all three samples. And I'll just say that like the variety of topics that they wanted to talk about was like extremely varied. And this was true actually with the first survey too, with the local researchers. Like it's really like super varied because it's like, which kind of underscores the way in which I think this is kind of interesting, like, the way in which sort of, when you turn on the news, right, the news is very nationalized. So you hear about like, this is what Trump is doing today kind of thing, or this is what the congressional Republicans, Democrats are fighting over, things like that. And of course, that's not unimportant, right? But like, a lot of like what is the agenda at the local level or even the state level is like goes way beyond a lot of that, right? So the kinds of things that people were talking about when we asked them, this was kind of a separate open-ended question, they would talk about like, I need to like, I do things, well, maybe related to sustainability, or I need to do things related to economic development, or I need to do things related to gun violence. I need to do, or I want to, engage on issues related to housing. That was a really common one, right? And so it was like extremely varied. And that, I mean, heck, there were other people who were like, honestly, like I got to talk about trash. What do we do with trash? And so it was really, really varied, which was also really interesting, I thought. So anyway, so there's an example of sort of of sort of like a few different types of sort of ways of kind of surfacing policymakers' unmet desire for science. I will also say that like there's actually another study which I literally just got the data yesterday, and I've like already sort of like kind of looked at it, but I didn't quite feel like it was ready for prime time. But it's about policymakers' unmet desire for neuroscience. And so anyway, if you sort of like check back with me in like a few weeks or so, I'm happy to kind of share that. But there's some I can already sort of see some of the interesting crosstabs, which kind of suggests that, there is sort of there is an unmet desire to engage with neuroscientists rather. So anyway, but I'll leave that for now. Again, that wasn't quite ready for prime time today. I can analyze data somewhat quickly, but not less than 24 hours quickly. Okay, so then so now let me turn to the question of like, okay, if there is this kind of unmet desire, and again, also just to kind of connect back up with kind of the bigger question here, remember sort of, my kind of like, sort of the reason why I think it's interesting to ask these questions and important to ask these questions is because the whole sort of like promise of like doing scientific research much of the time, especially like having like, taxpayers pay for it, is that we're producing knowledge that then is supposed to like improve our health, wealth, and security. And so, if the decision makers who are in like a really, big position to use a lot of that work don't have access to what they need, or feel like they would like benefit from engaging with scientists to learn more, that is like, I would argue there's an imperative to try to meet that unmet desire. So, okay, so here's a study about like how to maybe do that. So this was a study with a colleague of mine, Elizabeth Day. And so we're interested in basically like, what would it look like for researchers to do this? Now, of course, like, look, sometimes meeting unmet desire with policymakers would entail basically going to an intermediary. And there's great intermediaries that are available in like lots of different places, including at the Bloomberg School as well as, elsewhere. But sometimes intermediaries aren't necessarily around because after all, I mean, if you think, especially if you're talking about, say, local policymakers, there's like tens of thousands of them. No formal intermediary is going to ever be able to sort of like, reach all of them and stuff. And so what we're interested in is sort of like, in situations where, we might want to kind of try to meet this unmet desire, we as researchers might want to meet this unmet desire, ourselves, like what could that look like? So what the two of us have done is we developed this kind of very kind of, basic and, kind of somewhat broad model, which says, you know what? There's all of these institutionalized mechanisms for members of the public to engage with policymakers effectively as strangers, so basically introduce yourself. And normally we think about like those kinds of methods, those methods for basically public participation in democracy. We often think about it as sort of ways for like members of the public to, go to their elected officials and others, right? And say, look, like, this is the issue I care about, or, can you do something about this? Or, I'd like you to vote this way, or, whatever, right? That kind of stuff, right? Well, what would it look like if we as researchers use those institutionalized mechanisms to introduce ourselves and say, and ask the question, what kinds of challenges are you facing? And would it be helpful for you to interact with like us as researchers, right? What would that look like? So that's sort of what this model is. So basically so step one is we're looking for sort of institutionalized mechanisms for reaching decision makers that like, are not necessarily common ways, not to say that they're like, have never been done this way, but not necessarily common ways for researchers to engage in unprompted outreach to decision makers. Okay. Then we invite them to share policy challenges in which they think research might be helpful. And then among those that we meet with, we communicate them using a non-lobbying approach. And I'm happy to say more about that. That is like for any of you who have interacted with like the Lerner Center for Public Health Advocacy at the Bloomberg School, that's something that they teach people how to do like tremendously. But anyway, I'm going to black box that for now, but I'm happy to answer questions about, well, I'm happy to answer questions about any of this stuff. But anyway, so that's the basic model. And so this, by the way, you can see this kind of looks like it comes out of a paper. It does. Paper's not published yet, but anyway, it comes out of a paper. Okay, so we did 2 trials, which kind of put this into action. And here we're focused on, we could again focus on any number of decision makers, but Elizabeth and I first met when we were both faculty at Cornell. And actually, we first got the funding for this when we were both faculty at Cornell. And so it's focused on upstate New York, even though by the time we did this study, we both had moved from Cornell. But anyway, so it goes. And Cornell is in upstate New York. But anyway, so this was done in partnership with the New York State Association of Counties, which is the kind of the body that kind of represents county interest to Albany, and then also to like Senators Schumer and Gillibrand. Anyway, and so we focused on this was all by trial 1 was all by email. So we had a list of 424 elected county legislators, and we randomly assigned them to receive an email message, and we varied the contents of the email. We had a baseline, which basically just said, we are looking to strengthen connections between research and policy. We're funded by the William T. Grant Foundation. This is free to you. If you reach out to us, we will have a meeting with you to learn about your challenges, and then we'll produce a research brief to share with you. And then the other 2 interventions, A and B, we just added some extra information that we thought might be like a little bit more persuasive. It was basically just like a message test, though. Again, they were offered the chance to sign up to meet with a researcher, and then they received this kind of tailored brief on whatever policy challenge they were facing. And then we had a number of different outcomes in mind. We were interested in basically did people either not have a meeting? Did they have a meeting but not use what we shared? Did they have a meeting and use what they shared? And then also, like if we did all these briefs and we put them into an online library and we sent a link, we're also interested in the degree to which people access the library, even around like briefs that were not necessarily the thing that they requested. So anyway, so we did this. So the New York State Association of Counties, they sent these emails on our behalf, but like we wrote the email and it was kind of clear in there that if people responded, they were going to be interacting with us, not with NYSAC. So anyway, here's the results. So we cleared our calendars because we're like, oh my God, like we need to make sure we can field these, like, all the requests we're going to get, right? Well, that's not exactly how it turned out. It's a great example of how research doesn't always turn out the way that you might want it to. I mean, look, research is what it is, right? But I will just say, like, we definitely went into this sort of hoping that we might at least get greater than 0. These emails were not meant to demobilize people. Let's put it that way. Anyway, it didn't work. So these unprompted emails, even though they came from the New York State Association of Counties, which at least, has a decent amount of credibility among these legislators in upstate New York. Anyway, emails were not. So, and then we said, all right, fine. Let's try trial number 2. So trial number 2 was like, let's try an in-person intervention. So, email is one way is an institutionalized mechanism for members of the public to reach out to elected legislators. I mean, emails are on, all those emails are publicly available, right? I mean, again, NYSAC sent the emails, our emails rather, but the email addresses were all publicly available, right? But we said, all right, fine. Another thing that can happen is that like when the legislature meets, which is typically monthly, there's often a privilege of the floor part where members of the public can speak for 3 minutes. So, basically the chair will say, does anybody from the public want to talk? And then people in the public can kind of raise their hand. And then the chair will be like, you man in purple, like I recognize you. And then you kind of walk up and you sort of like, you address the chamber, that kind of thing. Okay. And so anyway, so we said, all right, what about if we use that mechanism? And one of the benefits of that too is that like, when you go to these legislature meetings, yes, technically it's a meeting of the elected body, but really lots of other people are there. If there's like a manager, a county manager or administrator or whatever, they're there. And then also like, a lot of the other people who work, like the kind of key people like a social service commissioner, other kinds of folks are often there as well. So you reach everybody. But we said, okay, let's basically do that. So we said, all right, we're going to now this is going to be county levels. This is not individual levels. So the N has basically shrunk from 424 down to 38. But we're going to say, all right, let's basically do a baseline where we have some counties where we just send emails like we did before. Let's do intervention A is emails. We're going to call them up because again, the phone numbers are again also like publicly available. And if they weren't publicly available, in fact, we took some of those counties out. And then intervention B is in person, is in person. We're basically one of us. So, and it turned out I did this part, where it's going to go to the legislative meeting and it's going to talk during privilege of the floor. And again, 3-minute spiel, this is who we are. We have this new initiative. It's free to you. We're funded by the William T. Grant Foundation, and then basically we would follow up with emails afterwards. But all the emails would say like, it was really great to speak to you, speak in front of the chamber today, as promised, here's a link. Okay. And then everything else was the same. So we would meet with them, learn about their challenges, give them a tailored brief, and then, outcomes and stuff like that. I will just say at this point, like I can say more about this at the end, right? But like, I do want to sort of acknowledge that like, this was a funded project. And so like all of the visits that I did, and the meetings that Elizabeth Day had afterwards, like, this was all funded. And so, because one of the kind of common things when I talk about this stuff, people are often thinking like, okay, great. Like, but like, I don't get rewarded for this. I don't have time for this and stuff like that. But one thing, so yes, we were funded. I do want to though acknowledge, right, that like, neither of us lived in upstate New York and we were doing it for a wide set of people. And I think it's a different sort of, or potentially a different calculus if you're thinking about like doing it to like, let's say just the county that you live in or things like that. But I can come back to that point. Okay. It's a little bit of putting the cart before the horse. Okay, so what were the, just to give you a sense, so I like taking selfies. So I took a selfie of all the counties that I visited in person. So there you go. This was all just for if anybody's from upstate New York, you like certainly know this, which is, so all these visits were basically in February, March, and April of 2023. And so you can see from the pictures, like all the different seasons of like upstate New York in like those like 3 months. And I'm happy to sort of point out the like most pleasant weather and the least pleasant was absolutely the picture that's in the bottom right-hand corner. Like I think the picture doesn't quite do justice to just how much the wind was howling when I took that picture. But anyway, what's on the right? So those are all the counties that are colored in are basically the counties that were part of this study. So the 38 counties. And they're colored in red if they voted for Trump in 2020. Again, this study was done in 2023, so we're using 2020 electoral data. And they're in blue if they voted for Biden. And I'm pointing this out just simply to say that like the large majority of counties, again, anybody who's from upstate New York, you know this already. The large majority of upstate New York is not New York City, right, in any way, shape, or form, and like is very rural and is quite conservative. And in fact, 10 of the 13 counties that I visited in person, were like voted for Trump and very much like overwhelmingly, of course, it's not everybody, right? But overwhelmingly were conservative. And I will say that like absolutely when I visited these counties, like I absolutely got like reactions from some people being like, wait, who are you? Like, what are you doing? Like you're from you drove up from Baltimore to like come visit, like, including like the one person in one county that should remain nameless, which is like, we have a project. The guy literally said this. We have a project with Columbia University. When was the last time somebody from New York City came up to our county? Which I thought was kind of funny. But like, anyway. But I do just want to sort of acknowledge that, like, the large majority, like, were, fairly concerned. And so, like, now, again, like, these are the areas we were in, not necessarily the people we met with. But I do just want to, as we sort of think about, like, kind of what does the kind of, again, social compact between, say, institutions of higher education look like with, with policymakers, with society at large? I'll just say that, like, that my experience is doing this, which is not necessarily gonna be everybody's experience. But my experience is doing this was that, like, for the most part, like, like everybody was polite, at least to my face. And in fact, a lot of people were sort of like, sort of taken aback, but not necessarily in a bad way, that like even like somebody like me would show up to a meeting and things like that. So anyway. All right, what were the results? So again, these are at the county level, And what you see is that the in-person intervention had an enormous effect here. And so really, I mean, so 9 out of 13 of the counties rather, we had at least one policymaker, if not more than one, request a meeting with us. And actually then afterwards say that they used the evidence. And they used it in a variety of different ways. Sometimes they were using it as part of like grant applications. Other times they were using it for other kinds of purposes. And I'm happy to sort of say more about that. But I really just want to acknowledge that, like, it really sort of it really did have an enormous impact. And the email only counties basically replicated what we had before. It's also the case, I don't have this up here on this slide, but it's also the case that afterwards, so after we basically created all the research briefs, sent them all to the policymakers, then put all of them onto a library online, and then sent the links out to everyone. So basically, like, we did all these visits in the spring of 2023. Then, like, we sent all the emails, followed up with folks who responded. Then, like, it was basically in the summer of 2023, we put everything online, and then we sort of emailed out, into the fall rather. And we put everything online, and then we gave everybody links. And we found that also even in the counties we visited in person, they were much more likely to then even access the research library as well. So the reach of those research briefs was also broader in addition to the measure of using them. Just to kind of give you a sense of what the research briefs were, I am actually happy to share the link. This stuff is all publicly available. And you see how basically, all of them start with kind of at the request of New York State county policymakers. So they're all sort of tied to our project. And this just gives you a sense about the kinds of things that people were asking about, which also is sort of a window into what the local policy agenda was in upstate New York. And this is, again, not all of them, but this is just kind of, I wanted to make sure the font was large enough. Mental health recurred in a number of different ways, quite a bit. Okay. So anyway, so that's it. So I'm gonna conclude and by saying, I think that the hope is, hopefully I've persuaded you, first of all, that simply asking the question, is there an unmet desire for science among decision makers is an important question. And in doing that, is one way in which we can strengthen this kind of longstanding social compact between research universities and kind of society at large and decision makers. And it turns out, that when doing that, asking these kinds of questions, that really, at least in a lot of the examples I presented, there really is this kind of unmet desire. And so I think it's important to think about how to both surface it and how to meet it. And I remember 40 minutes ago, I said, my hope is I sort of can share something that is both interesting and actionable. And so kind of in the realm of doing that, I mean, so hopefully what I've said so far is at least somewhat interesting. At least greater than zero. But on the actionable side of things is sort of this question about how, where might you do it? And so I think that, questions to ask yourself is sort of, what kind of, given the research that you do and where you live and maybe what kinds of policy issues, you care about, what kinds of decision makers, do formal intermediaries exist, right? So, if, you'd say I really want to interact with this person on Capitol Hill, well, then for example, Johns Hopkins has an office devoted to that, or I want to interact with this person in Annapolis. Well, Johns Hopkins has an office for that too. But if you say I'm guessing many of the people on this call are potentially from places, far and wide, far away from, say, Baltimore, perhaps far away from Maryland. And so, what might it look like for you to potentially interact with, say, various kinds of local policymakers who are, both geographically proximate and also, quite frankly, often easier to reach, than some of the other folks. So anyway, so do formal intermediaries exist or do they not? And, if they don't, are there institutionalized mechanisms? And again, my experience going to the counties was really, typically, I was going to the podium in between the person complaining about trash and the person complaining about, the local schools, right? I mean, that's what that looked like, right? And so that's why, the response was often kind of like, who are you? But, at the same time, right, that was an institutionalized mechanism for members of the public, even people who start off as strangers like me, to go there and to sort of introduce myself. And so anyway, so this is like the last slide. And I really do want to sort of again emphasize, in this last part, this how, where might you do it? I really do want to sort of emphasize, right, that like, I try to be sort of careful about this, that like, is that because people will sort of say, oh my God, does this mean that everybody should go do in-person visits? And I think the answer is like, maybe, but like, I want to be mindful of the fact that like not everyone is going to feel comfortable doing in-person visits to like various kinds of decision makers. And I think it's really important to kind of say that and sort of acknowledge that like I don't know if that's actually the conclusion or not. Just about an hour ago, we learned the William T. Grant Foundation is funding Elizabeth and I to basically do to scale this model across the country. And so we'll see what happens. That'll start. Well, now it'll start on November 1st. But anyway, this is what we have so far. So anyway, so thank you so much, everybody, for listening. And I think I've been like looking at my clock. I'm like, yes, I have stuck to the like 40 minutes. And so I really am like, look forward to questions, comments, concerns, and anything like that, anything along the dimensions of what might have been interesting, not interesting, what might be actionable, what might not be actionable. So I will stop sharing my screen to do that so I can see everybody. And yeah, thank you so much.
Thank you, Adam. You probably saw the applause and all the reactions and coming up. So I think people have been pretty excited and engaged. And there have been questions in the chat along the way as well. So first of all, I just want to thank you because I remember hearing you talk about some of this earlier and really thinking how important it is for other researchers to know about this, because I think a lot of us don't know about the fact that policymakers are interested in hearing from us. And many of us haven't even heard about like these different ways of engaging with them. I think it's very enlightening to know that, doing the sort of sending letters and all of those things are helpful, clearly. But for some of the more specific things that we're looking for, we're really looking not just to get people to vote a certain way or something like that. We are really looking to see if we can be involved in helping them with decision making. That it seems like from your work is showing that we have to show up. So I want to thank you for that. And I could ask questions, but I'm going to make sure that other people have a chance to ask theirs before I chime in. So.
Should I go through the chat
Sure.
comments?
Like let me see if I can go back through for you to say, so people were talking about, I guess at the beginning when you talked about the different outcomes that we care about. I think one person mentioned community health, which I think is related to, what you had talked about before. There were some questions about how many people were in your surveys and questions about your, getting citations for the studies. So I think we can maybe help with that afterwards. But those were some of the questions. So what are some of your reactions from the group? I think also the idea that, going to local people is something that I think we can all do, and I think this is just incredibly creative, the design you guys chose. And it's very courageous that you went ahead and did it and reported that, hey, sending an email to just give people like an FYI doesn't really result in anything. So Deidre, do you want to ask your question first?
Yeah. Well, first, just thank you, Adam, for a great talk, both in content and style. I have to say, I enjoyed the style. So I was wondering, and it was trying to sort of understand whether your team was equipped to kind of answer any question that they might have, and sort of how was that the case? Like, how are you equipped in that way? Because my sense, and I think Lisa was sort of alluding to this, is that when most of us, I think, tend to think about engaging with policymakers, we're thinking about our own specific discipline, right? And how we might be able to help them with that area. But how did you all navigate the fact that they could have asked for kind of anything, maybe in the in the space of in terms of science or sort of evidence. They could have asked for just about anything, it sounds like. Is that right?
Yeah, so I'm glad you asked that. So that the study was funded by the William T. Grant Foundation, and they're interested in sort of like research use as it improves the lives of children and families. And so what we did is when we did when we offered stuff, both actually the emails as well as the in-person, part of the script very much said like that we're only focused on issues related to sort of children and families, which itself admittedly is quite broad. We did then, the policymakers that we emailed, like everybody that we're emailing, were only, and I didn't say this before, just in the interest of sort of not delving too much into the details, but like, but the policymakers that we emailed were only people who were basically on committees that were related to sort of like children and family related stuff. So it's usually sort of committees that were sort of related to and they had like a few different like community. They would either maybe have like community in them, welfare in them, like human services in them, like they kind of different sort of titles like that. And so those are the people that we sort of emailed, and that's what we said also in the prompt. However, having said all that, that's still pretty broad. And so this is where if my comparative advantage is being willing to go into like rooms full of strangers. Elizabeth Day's comparative advantage, my co-PI, is that she actually knows about like a wide range of topics and has been doing sort of research kind of in sort of children and family related topics like for a really long time. And so she basically like she assembled a team. She is at the University of Oregon. She assembled a team of graduate research assistants, and basically like they responded to the requests. And I will say so. I can share the link of where those research briefs are if anybody's curious to see what they look like. But they they are on different topics. There were definitely overlaps across the topics. Like for the most part, a lot of people were asking about like things related to mental health. Some cases, different parts of it, but like, and kind of multi-system involvement. That was another thing that came up a lot. But but anyway, and so yeah, so that's kind of like the one thing actually, interestingly enough, that didn't come up that much was education. I actually thought so. Their learning loss was one of the things, but like kind of other topics related to education, actually, that didn't come up. We thought it might, but it didn't. And so, but anyway, but yeah, but no, but to your point, there was always like a little bit of not hesitation so much, but like a little bit of anxiety around like what are they going to ask for?
Yeah.
And yeah, no, I think that like, and there was always sort of like a possibility that like we might have to kind of in a pinch, basically sort of, lean on another colleague or friend of ours or something on a topic. That didn't happen, but we were definitely sort of prepared for it. But so that's why I often will tell. So when we do the way that we're planning to do the kind of study that's going to see if we can generalize this result to a broader set of folks is basically training a whole variety of researchers to go off and do this in counties where they live. And we will have to basically sort of like kind of like make sure that the script sort of specifies something that kind of more closely hews to kind of what they do. Sorry, and then the last thing I'll just say about this, and then I'll stop, is that the other thing, one thing that is like absolutely fascinating about interacting with like policymakers and just decision makers, I think I find this interacting with like, say, civic leaders as well, is like, and I try to tell this to like even like graduate students a bit, which is that like, so much of like academia, I feel like is sort of is just kind of depressing. It's about like telling you why you're wrong, like how you don't know enough, and like, how you like, or how you don't know as much as this other person or like whatever, either implicitly or explicitly. And I'm like, it turns out when you go and interact with like policymakers who like are like trying to like improve people's lives, right? Like, which, I mean, I know that that's not always what's on the news, right? But like a lot of them, like that really is what they're trying to do. And like, they like, it turns out that like we know so much more than we, I think, often give ourselves credit for. And like, and it is a nice reminder sometimes. Like I've had policymakers ask me about like fundamentals of survey research, just like how do you like even design a survey? And I'm like, oh, actually, funny you should ask. Like, and I can go over like the fundamentals about like, the psychology of survey response and stuff like that, which I teach to, students and PhD students, whatever. Anyway, it's just kind of this like, And so again, it isn't always that way, you know, and I'm not going to say that like, you know, we didn't experience this, but like, you know, I'm not going to say that like, you know, decision makers can't be assholes sometimes. Hopefully I can say that in this room, but like, you know,
Yes.
and so I don't want to sort of like, you know, paint everything with like, you know, a rosy whatever, but I will say that like that experience of sort of being like, you know, wait a minute, like I actually know, like I'm like way more of an expert than I might even know or give myself credit for, or other people give me credit for. I do think that experience is not totally infrequent. So anyway, all right, I'll stop talking.
No,
No,
that's
thank
great.
you.
That's great. So I see Chidima has her hand up, and then I have a couple of questions from the chat too. So Chidima.
Thanks, Lisa. First of all, that was such a wonderful talk, and I echo everything Lisa and Deidre said, not just the content of what you said, but the way you delivered it. You are really funny, and I was
Thank you.
cackling in my office. So I really want to thank you for adding levity, with such a serious topic too. Um, the question I have is, your study was done in New York, which I know it has pockets of, various, how do I put this? Political temperaments, but by and large is kind of more liberal leaning than some other states. And I was just curious what your thoughts are about what it might look like to implement your trial in in a more like partisan type of environment, where there might be, to some extent, open hostility in terms of in-person interactions, which seem to be the most effective way to get people to incorporate evidence in their policy agenda. And I'm also curious how this work that you've done interfaces with misinformation and this kind of growing climate around anti-science. So I was just curious about anything you have to share about those things.
Yeah, no. Thank you so much for those questions. And so let me, as you were talking, I was pulling up the data from the. So I'll do the. Let me do the first question first about just sort of like about like kind of New York and its potential peculiarities, and then the second question about the misinformation point. So on the first point, on the geographic area, I guess I can't, well, I won't share the screen. So it is, so first of all, yeah, so upstate New York, on the one hand, it is, I think like, it is way more conservative. I think that people often, I mean, when people think of New York, they often think of New York City, but like, unless you're from upstate New York. And so, you know, with the exception of kind of the like little like blue pockets of basically Buffalo, Rochester, Syracuse, Albany, and then the lower Hudson Valley, it is all fairly conservative and fairly rural. And so the for you know and so like but having said that, right? So like the average, I'm sorry, so I'm actually looking at data that's like from the working paper, just so the average household income, or sorry, the median household income, rather, excuse me, for the counties that in our study, so the 38 counties in our study, which was not the 13 I visited, but the 38 in the study, was approximately the same as the U.S. So it was about 75,000. The U.S. is 78,000. The percentage of population under 18, which is relevant given that we were talking about children and families, was about 19%. For the U.S. as a whole, it's about 21%. And so with a college degree, so we were largely, it was less college educated population, so 30% relative to 35% across the entire country. Here's the biggest difference. Well, actually, so percentage of folks who voted for Trump, so two-party vote for Trump in 2020 was 54% in our 38 counties relative to 48%. As we all know, he lost the popular vote in 2020. And so they were more likely to support Trump. Here's the biggest difference more than anything else. It was overwhelmingly white. And so the percentage within our 38 counties who were white was 84%, whereas for the U.S. as a whole, it's 58%. So that was really a long, like, sort of, so this is all the data that we have, like, in the paper. And so that's like absolutely like the biggest, like, you know, difference right there. And so, but you know, there is a lot of sort of like conservative folks. So the question about sort of how it, so the real answer to your question, I think, of sort of like, what would it might look like to do this elsewhere, is that's actually why we wanted to have the William T. Grant Foundation fund a bigger study. And in fact, that's actually because we know that that's an important question. And, I mean, I'm just thinking about, I presented these findings at a William T. Grant, like kind of grantee meeting thing last year. And I was on a panel with a colleague who's from the University of Memphis. And, she was saying, I mean, we were talking about this stuff in advance and whatever. And like I said to her, I was like, look, like, I actually used to be, I had a postdoc at Vanderbilt. So I've lived in Nashville, but, in Tennessee, but in Nashville. And, and I said to her, I was like, look, am I going to tell you to basically go out to like parts of like rural Tennessee and just introduce yourself? Well, I don't know. Maybe not. And so like, and she was like, I don't know that I want to do that. And stuff. In Memphis, okay, maybe, but like, or in the county that Memphis is in. But anyway. And so I think I think the short answer is we just don't know, but it's a great question. And that was why we're excited to do this other study. And we're going to try to, I think we actually might try to block, like, so when we do the random, it's going to be also a randomized control trial. And when we block, we actually might try to block on basically whether or not the people who are doing the outreach are in more conservative versus kind of more like, or more red versus blue areas. So anyway, that's the first question. On the second question about sort of misinformation, and thank you for allowing me to present some of that data about just sort of about kind of the upstate New York, the area where that study took place. On the misinformation, so I am like, it's very interesting. Like, I think this is like a super interesting topic. And it's like, I don't think, so we can't with our data. I almost like want to be able to sort of say, oh my goodness, we have like, this is a way to sort of combat misinformation. And we can't really do that with our data. I will say though, for what it's worth, that, it was interesting that like we were looking for, when the policymakers met with us or any kinds of responses whatsoever, we were sort of interested in basically just kind of like, just from a qualitative perspective, like, did they mention any, like, were they mentioning misinformation? Like, I read this study about youth mental health, like, was that right? Like that kind of stuff. Mm-hmm. And we didn't observe any of that, which of course is not to say that like, it's not there. I do sort of wonder, and again, this is, the truth value of what I'm about to say is less than 1, even though I realize this is being recorded. Okay, but like, just because it's like purely speculative. But I do sort of wonder whether it matters that so many of the issues that we were actually engaging with the policymakers on were not subject to kind of like national political cleavages, and if that made a difference. I think the one thing, and you saw this on like the screenshot, the learning loss stuff, that was definitely related to education. People were absolutely, I mean, if I take you back to like the spring of 2023, people were absolutely sort of like, at the national level, as well as other, fighting about like kind of education, school closures, learning loss was part of that, to some extent, right? And so like, and so I think like, that maybe might have been subject to it, but we didn't observe that. But, it is interesting, right? I mean, like, like I think, I always come back to this point. There was this great article that got published in 2020 about the need for trustworthiness before trust. And if like if one of the concerns, right, is a lack of trust towards like institutions of higher education, which, there is evidence that there has been an erosion of trust, even just in the past 5 years. I think we're still doing better than many institutions across society, including Congress. But nevertheless, the trust levels have eroded. It's hard to sort of build trust. If people don't trust you, it's hard to sort of like communicate your way out of that. And so relationship building does seem like it would be a helpful approach. But, I'd be lying if I really thought that our results could like directly kind of speak to that. But I think it's like such an important question and an important topic. Oh, wait, can I actually go back to one other thing, which is, I will say, okay, I do have stories from like visiting these counties and whatnot. There was one county where I would say I felt like extremely like sort of uncomfortable, and like uncomfortable to the point where like I remember afterwards emailing my faculty mentor in my department, who at the time was Keisha Pollock Porter, who's now the dean of the Bloomberg School. But she was my faculty mentor. I was still an associate professor at the time, so she was like my full professor, faculty mentor. And it was like that one time where I emailed her afterwards, and I was like, Keisha, like I visited this. She knew I was doing this project, like, and I said, Keisha, I visited this county. This is what happened, and it was because of actually other people in the gallery. So it wasn't because of the electeds at all or anybody else with like official positions. It was because of the gallery. And the county had gone into executive session. So basically like the meeting started, they did some stuff, but then they went to executive session, which meant that basically all the people in the gallery, the public, had to leave. So we had to go basically all go stand in the hallway for like whatever it was, 20 minutes or so. And there were people who came up to me who were like, who are you? What are you doing? Whatever. And then like once they like, I would say who I am. I'm from Johns Hopkins. I'm in the public health school, whatever, because they would ask these questions. And then like, clearly sort of were like, they were very much primed to blame public health and, and me at that moment for like all sorts of things. Okay. And that was uncomfortable. And so so I was sort of like, how do I respond to this and blah, 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 like, and like, definitely just one of those moments where you're like, am I going to basically end up on some like random website tomorrow and like, whatever. And so that was the only time. And that was due to other people in the gallery, not due to electeds or anybody else. I have other stories, but just because you asked that kind of more directly relates to your question.
Yeah, thank you so much for such a thoughtful answer. And I guess to me, and it's just a comment perhaps for future consideration, but I'm curious to think about the identity of the researcher and how that might also influence the extent of, a policymaker's receptivity to what they have to say, as well as what you mentioned toward the end of your response, which is the topic that you end up mentioning. Like some topics are not as activating as others. So yeah, but maybe that's what your trial will explore. If you need a researcher to participate.
Well, it can't be you because now you know what the hypotheses are.
Oh, okay, never mind.
But I think I think you're absolutely right. And actually, okay, sorry, I know you meant that as a comment, not a question, but I will just say two things on that. One is, I think that what you're saying about the identity of the researcher is absolutely something we're thinking about, and so the idea is we're gonna train 75 people to go be doing this across the country. They're gonna be like randomized to go do stuff across the country, and so and this is something we are absolutely thinking about, like kind of the kinds of people that we are sending to certain places. I will also say it is interesting. There are, while it's true that I think mental health was sort of is maybe a little bit more of a, people don't tend to sort of disagree about sort of the idea that like mental health is like, that people should be mentally healthy, that like mental health is like something that we should be concerned about if like, youth are not, are experiencing mental illness in like lots of different ways and whatever. But there were some topics, and I guess it wasn't on my screenshot, that like, I think were definitely more, could be. Yeah, now that I'm thinking about it, there were a couple that I think, so the learning loss one, which I think could be viewed as sort of maybe a little bit more of like kind of like lightning rods and even maybe tied to sort of national debates more. There was another one that this came from an elected legislator in Niagara County, which was all about sort of like about policing. And so he was very much like, his whole question was very much sort of like, started from like George Floyd happened. We need to like, be thinking about sort of policing and how police interact with community members. And so that was an example of like something that would be like definitely potentially more of a controversial issue. Or at least let's put it this way. I know it was in that county because he said as much. So yeah.
Thank you
Fascinating.
so much.
Fascinating. Well, we have a couple questions from the chat, and then I would love to comment on something that you said earlier, Adam. But I want to make sure these questions are answered. So one of them is about the first one I think is probably pretty quick and easy, and it says policymakers and decision makers may only spend a brief amount of time reviewing materials. Can you please comment on the length and scope of a health topic brief? How did you determine, on the length and the scope of your policy briefs?
Yeah, no, that's a great question. And also I'm noticing somebody, I'm glad that trustworthiness before trust. I didn't make that up. That was like definitely, that was the Nijam article. I teach that article every year. So that's great. I was worried about giving
trustworthiness and trust here too, by the way. That's one of our things too.
Oh, cool. Yeah. I was worried about giving like a random citation, like verbally, because people are like, wait, what? Like, and so I'm glad somebody put Devin put the link in. But yeah, so yeah. So on the length, so this was actually, so my colleague Elizabeth Day, like she has, she and actually her dissertation advisor and co-author has like a ton of experience, like way more experience doing this than I do. And so actually, this was like we're a pretty cool team. It's pretty. I have to say, it's pretty awesome when you find like a co-PI, like where you work well together, and also like you kind of bring. Well, to the point about collaboration, like diverse kind of forms of expertise together. And so she actually had a lot of experience interacting with policymakers on children and family related topics, actually from prior William T. Grant funded projects that she was on. So anyway, so she had kind of a good sort of feel for that. The length, if I give the link, I keep on, I should just put it in the chat box. I feel like I'm like constantly referring to this like phantom link. But anyway, I'll try to find it quickly. But anyway, so like so she did like she sort of had a good feel for sort of like how to do it. And also she's also good at adding like graphics and stuff to make it like a little bit more readable. And then include citations. I mean, there's citations. And, you know, some of the stuff I'll just say, like, there were a few times where what happened was she and her team basically was citing work that had been published. But sometimes, you know, they were asking questions about things where there isn't necessarily published research specifically on that. So like, for example, like, you know, some of these counties were really, because they're rural and they have populations that can't necessarily, where the transportation options really aren't very good. And so they were interested in like, you know, how do we, like, they would be like, oh, you know, we have this kind of like mobile van, or like we're interested, or either we have one or we're interested in getting one or whatever. You know, what does the research say on like, you know, how to effectively use mobile vans to provide services to like rural populations? And like, if I recall correctly for that, like, there wasn't really a ton of like published research. I mean, there certainly wasn't published research on like, you know, here's how mobile vans have been used in like upstate New York counties. Like there definitely wasn't anything on that. If anything, there might have been like stuff like published on like, oh, here's the experience of how it was used in Harris County, Texas, or like where Houston is, or, you know, things like that. So anyway, so those were examples where, you know, they really had to like kind of like essentially do like initial, and actually this is a great in response to Deidre's question from before, that where they actually, she and her team actually had to do like effectively primary data collection. And, you know, it wasn't like super involved, but it was involved a little bit. And it did kind of underscore the way in which, you know, it did take a bit of time. And then actually then, and to this point, I mean, you know, I think that like, you know, doing this work well. I mean, I'm not going to claim, right, that it takes no time. I think like, you know, I do think it's important. And I would argue, and this kind of gets more like kind of an institutional policy question. I wish that there were ways to, I think, or let me put it differently. I think we need to create ways, we, the royal we, need to create ways to both legitimize and to elevate and to value this kind of activity more. You know, I think, you know, in the Bloomberg School, for example, like, you know, when people get quoted in newspapers, like that stuff gets blasted out all the time. Like, why not sort of like, you know, when stuff like that, like these kinds of collaborative relationships get formed, like, why not share that? Now, sometimes, of course, like it can't be for a variety of reasons because it's, you know, sensitive information, whatever. Okay, fine. But there's a lot of cases where like, you know, what's happening is not necessarily super sensitive, right? And so the fact that it's happening, like that ought to be shared, I think. And it isn't always, but it could be.
Yeah. So yeah, you're bringing up some really interesting points here. There's another question that says, if there's no formal way to reach out to policymakers, how would you build a platform that is safe for researchers and policymakers to interact? So.
Oh my goodness. Okay. You are like taking me back. So as Lisa mentioned at the beginning, I didn't talk about it much in this talk, but like, so I run this organization called Research for Impact and rforimpact.org. And we're a matchmaking service. And right now the way that it works is like, if you were to go to our website, you'll see sort of like like what our vision is and also kind of what we do. But the kind of nuts and bolts of how it works is it's a fairly kind of hands-on thing where we, you know, craft newsletters of people who are looking for sort of new collaborative relationships. We publish these newsletters, people respond to us, and then we broker the matches. So it's fairly like hands-on and, you know, somewhat labor intensive, but it's a lot of fun and you know, apparently fills a need. But the first version of Research for Impact, which was back in 2017, was a LinkedIn-style online platform where researchers and practitioners and policymakers could build profiles, and then just like LinkedIn, they could reach out to each other. But like the profiles were kind of geared towards what kinds of cross-sector collaborative relationships you might want. And so within the first 7 months, 388, or sorry, first 10 months rather, 388 people had built profiles, which like seemed like it was like great, like from again, cross sector, all that kind of stuff. And we were like, wow, this is amazing, awesome, blah, blah, blah. Well, but of course our theory of change was that like, this platform would actually lead to new collaborative relationships, not just that people would create these profiles and like, pat themselves on the back. Well, there was just one problem. Even though 388 people built profiles within the first 10 months, only 7 of them actually reached out to anyone else. And so it kind of underscored the way to me that like, kind of on the one hand, it feels like there should be this kind of like, great technological solution, but yet in practice, I think it's really sort of challenging. And the book, Collaborate Now, that I have the little screenshot of, it actually opens with this example because this was actually the thing that first got me interested in studying kind of the science of collaboration. It was actually that experience, that failure essentially got me interested because I was like, like all these people built these profiles and like, like they took the time and effort and energy and clearly they were interested in all this kind of stuff to build these profiles and yet they didn't use them and like kind of what's going on. Like that's kind of puzzling in a way, right? And so anyway, so I don't want to say that like a platform like couldn't be used. And Lord knows, I mean, like LinkedIn is an example that is seemingly successful. I don't know. LinkedIn tells me it's successful. Actually, there's another example in the book that I have. I have this kind of case comparison with this other organization called Catchafire, which is an online platform for connecting practitioners, so nonprofit practitioners. So similar, we had nonprofit practitioners as well, which has been more successful. And I kind of describe in detail kind of like what did they do differently? Basically, how do they kind of make strangers more comfortable interacting with each other? Because that was really what I observed with Research for Impact was basically that sort of strangers were not feeling comfortable interacting with each other. And so, I do wonder, I mean, so like the Lerner Center for Public Health Advocacy, they often act as a matchmaker and stuff. And like, for in various ways, they do lots of things, but that's one of the things that they do. For certain kinds of policymakers. Certainly, we have our federal relations team at Johns Hopkins and our state relations team at Johns Hopkins, so they do that as well. But I do think, it is interesting. I don't know that I have a good answer for sort of what does it look like kind of more broadly. And I mean, at the very least, I think it is worth thinking about at least starting with kind of institutionalized mechanisms, even if like, let's say, you're like, well, okay, fine. I could go maybe connect with like, let's say these county policymakers, but who I really want to connect with, let's say, are the people who run the like 4-H club or, something like that. And so, but maybe, that could be an introduction down the line. That's at least kind of that's my running theory of change for now.
Yeah. So Adam, this is all like fascinating. I mean, I think one of the things that I've noticed is that people don't act on these things unless they actually have something in the moment that they're dealing with and they need help right then. So I'm just wondering whether a platform that sort of where people could put in a question, like say they have a specific question or a specific need, and then get matched to an appropriate sort of, scientist who could, sort of work with them on that would actually be something where it was more likely to be used. Because I think people they might set up a profile, but they're not going to do anything about that until something comes up that they actually need to make a decision about, right? So that's one thing that I thought about. That there's one way that maybe technology could kind of help with bringing people together at a specific time of need, right?
Yeah, and actually, it's a really good idea. And in fact, there's a couple of there are some other examples I talk about also in the book. Sorry for talking about the book so much, but like they are in there about like sort of like the way in which like the National Health Service in the UK set up something similar to connect basically practitioners, so like nurses, doctors, whatever, with researchers. And they had and it was an online platform, which also didn't work initially. But then, though, to your point, they had staff who were basically making the connections and stuff. I mean, I'll admit when we started Research for Impact, it was me and I had 2 co-founders. All of us are professors, and that's the thing that pays the bills. Like that was our full-time job. And so, we were kind of like, we don't, we aren't necessarily, don't necessarily have the time or the capacity, at least at that point, to sort of actively do the matches. Although now I do that, but now through this newsletter. But it is interesting, like, so when I've given talks on like kind of unmet desire stuff in other groups, including like, for example, CMAP at the Bloomberg School, the mental health group. mental health and policy. You know, what I've done sometimes is then like, you know, do like follow-up, basically one-on-one consultations, which are sort of like to get people to kind of, it's kind of an excuse to sort of talk through like how might you use this. And then like it also sort of, it provides a little bit of a you know, a bit of a check, or a, you know, you're kind of become accountable sort of to somebody else. You know, because someone else, you know, you set up these meetings and like you know that like I'm going to ask you, oh, what did you do?
No.
And you know, it's not foolproof. People cancel meetings sometimes, but it's at least a sort of a way of kind of, you know, having that and occasioning the conversation, you know, and stuff.
Yeah.
It's a little bit, obviously it's more resource intensive, but you know, but it can be kind of fun too.
This has been so exciting, and it is 4:30, but I just do want to say something that sort of to build on what you said earlier about us knowing a lot more than we think we do. I know that for one thing, me having interacted in spaces with policymakers over the last few years, I realized that when you're a scientist and you're a researcher, you're used to having to like know everything about a particular topic before you actually feel comfortable about it. Whereas policymakers are not looking for that level of detail or specificity. And it's okay that you may not have everything, or that all the literature may not be like completely consistent with a particular thing. They're not looking for that degree of specificity, you know, in a lot of cases. And so I think one of the things lessons we should take home is that whole point that you made about the fact that we do know a lot. And not only do we know a lot, but we are connected to other people with expertise and knowledge that can help other people. And so we don't have to feel kind of overwhelmed or unable to meet the moment when we are in those rooms. So I just wanted to put that out there for others to think about as we sort of think about how we can be more engaged with policymakers. I don't necessarily want to have the last word. I think, Adam, you were fabulous. Do you have any other closing thoughts for us before we wrap up? And thank you again for
Yeah,
such
no,
a
I'm so happy you raised that point, because it like we know more, and also like, yeah, like they don't like the level of detail, because it's just, you know, I feel like when I'm presenting, I'm like, you know, I'm like, oh my God, I need to remember exactly like how was the question phrased, you know, make sure I got like my decimal points correct. You think about all that stuff, and like, and sometimes that's important. You certainly don't want to get it wrong in written work and whatnot, but
Yeah.
it's like it's true, and like that often doesn't, that kind of detail just isn't like that important. I'm so glad you raised that. I just like, it looks like I can't email the whole Zoom chat, but I did just email the Center for Health Equity person, like I direct
Okay.
messaged the link to where the briefs are, in case, so where the library is, where that screenshot
Oh,
came from. And so
okay.
I mean, I could,
Latoya, did you want to put that link in the chat? Are you still there?
Yes, I'm still here. It's in the chat, so we'll send it out in the email when we send the
Oh,
email out to everyone
oh,
with the
okay, great.
recording.
Yeah,
okay.
thank you.
We will do that.
And you'll see there's other stuff on there that is not quite related to us, but all the stuff that starts with "at the request of New York State County policymakers" is on there. So again, if anybody's interested, those briefs are from now. Again, the latest one would be like the middle of 2023. So anyway, that's just to be
That's
clear on timing. But if
that's
you're interested,
pretty up to date.
yeah, I know, right?
Yeah.
But yeah, no, but thank you so much.
Yeah.
I really appreciate all the questions and the chat. And I guess like if I would love to get a copy of the chat if that's possible afterwards too. But I just really appreciate it. Thank you so much for everybody for your time. And if anybody does want to follow up, and also, and especially like, you know, think about like how they might, you know, what it might look like for you to put some of this stuff into practice yourself, or not, or, you know, whatever. Please don't hesitate to email me. I guess I'll put that in well, I guess that'll be in the email. AdamSeth@jhu.edu.
It will be. Thank you so much again, Adam. This was amazing. And thank you everyone for hanging in there till the very end, and for being so engaged. And we look forward to hearing more about your exciting findings, especially your large national study that you're about to do. So congratulations on that.
Thank you so much. Thanks,
All
everybody.
right. Bye, everyone. Thank
so
you.
much.
Bye.